Assalamualaikum. I'm Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine, Bashundhara Ad-din Medical College. Today, we'll discuss the discussion from our previous lecture, regional injury, as we have completed before the skull fractures. Again, skull fractures is divided into two types, fracture of the vault of the skull as well as fracture of the base of the skull. In case of vault of the skull, there are commonly fissure fracture, also termed as linear fracture, depressed fracture, commonly said signature fracture, elevated fracture, comminuted fracture when combined is crushed, or mosaic pattern called spider web fracture, gutter fracture, pond fracture, commonly in children also termed as indented or ping pong ball fracture, perforating fracture, stellate fracture, that is in a radiating manner or also termed as radiating fracture, cut fracture, and finally diastic fracture, that is along the suture line of the skull, also termed as diastasis. Fissure fracture is a linear fracture or cracking involving the outer or inner table or even both, sometimes involving only the inner table if it is fragile, commonly detected in X-ray, but in this case cannot. The site of impact is indicated by a hematoma of the skull, either direct blow from the stick or indirect from fall from height. When a blow is struck, fracture starts at the site of impact and run parallel to the direction of force. It involves the coup fracture, also contra coup fracture, and finally bursting fracture. Depressed fracture, commonly termed as signature fracture, because it gives easily the clue regarding the causative weapon. It is commonly caused by heavy weapons with small strikes such as hammer, axe, stick or even stone. The broken fragments are driven inwards, resulting the size, shape of the causative weapon signature. A late effect of depressed fracture may be post-traumatic epilepsy. Elevated fracture is one in which the fractured fragment is elevated above the surface of the skull, while the other end dips down into the cranial cavity. That may result injury to the brain directly by piercing the dura mater, caused by striking with a moderately heavy sharp-edged weapon such as axe. In case of comminuted fracture, it is also termed crushed fracture. Here, the bone is broken into two or more pieces, commonly caused by vehicle accident, fall from height, blow from weapons with large striking surface. It usually occurs as a complication of depressed fracture when the fracture fragments are not displaced, taking the stellate appearance, that is radiating manner. Pond fracture is also termed as indented fracture, commonly occur in children due to elasticity of the skull bone is less. It is a simple dent on the skull resulting from obstetric forceps blade, also from blow by blunt object or impact against some protruding object. Fissure fracture may be seen round the periphery of the dent. In case of gutter fracture, it is caused by glancing bullet wound. A part of thickness of the skull bone is removed in this case. This may only be longitudinal depression of the outer table alone without any loss of underneath bone, affecting the thickness of the skull bone, leading to an irregular depression fracture of the inner table. In case of stellate fracture, comminuted fractures are involved, causing the fragments held intact and manner is radiating. Causes are vehicle accident, fall from height, striking by heavy weapon like iron bar or with a wide surface. In case of diastic fracture, it is a comminuted fracture with fracture fragments remain intact. Suture line fracture occurs along with the suture of the skull. Commonly occur in case of young person as well as the children. Causes are vehicle injury, fall from height and blows with broad striking surface. In case of perforating fracture, irregular depressed fracture on the inner table. The skull is affected, leading to the thickness, also called as punctured fracture. The weapon passes through both tables, leaving more or less clean-cut opening with size and shape of the corresponding to the cross section of the weapon used. May be observed without any loss of bone integrity underneath. Common causes are firearm weapon wound, that is glancing bullet with pointed sharp weapons. Now, fractures of base of skull. It commonly involves anterior cranial fossa, middle cranial fossa, posterior cranial fossa, as well as fracture around the foramen magnum, and a special type hinge fracture or transverse fracture seen on motorcyclist people. In case of ring fracture, it is around the foramen magnum. It is a fissure fracture about 3.5 cm outside the foramen magnum at the back sides of skull and passes forward through the middle ear and roof of nose, due to which the skull is separated from the spine. It is rare, usually requires a lot of force to produce, and it results commonly from fall from height on the feet or on the buttock, sudden violent twist of the head on spine, severe blow on the vertex, which drives the skull downward on the vertebral column, and a heavy blow directed underneath the occiput or chin. Complications commonly arise from fractured skull is cerebral injury involving concussion, compression, contusion and laceration of brain, hemorrhage, shock, damage to the surrounding structures, fat embolism, infection and also traumatic epilepsy. Now, brain injury. It is also termed as traumatic brain injury, as the injury is originated from trauma, commonly caused by motor vehicle accident, fall from height and also assault in homicidal manner. Traumatic brain injury happens to be the major cause of death among the population less than 45 years of age, classified as primary brain injury as well as secondary brain injury. In case of primary brain injury, these are concussion, cortical contusion or cortical laceration, diffuse axonal injury, bone fragmentation and brainstem contusion. In case of secondary injury, these are intracranial hematoma, cerebral edema, infection, ischemia, epilepsy, metabolic or endocrine disturbances. In case of cerebral injury, the injuries are commonly held by mechanism of acceleration, deceleration, shear strain or rotation injury, coup lesion and as well as contra-coup injury. Acceleration or deceleration injury involving diffuse neuronal injury, diffuse axonal injury and subdural hematoma. And in case of impact injury, these are cerebral concussion, contusion, laceration and intracranial hematoma or hemorrhage. In case of coup lesion and contra-coup lesion are caused when forces strike in a fixed head. In case of contra-coup, it occurs when a moving head strikes a hard surface. When a person gets a blow on a resting head, indentation of the scalp occur, results coup contusion, and when a person fall on head and the head is moving, ground is stationary, results contra-coup contusion. Cerebral concussion is a stunning brain shock or commotio cerebri in which the temporary derangement of the neuronal activity occur, especially in decelerating injuries. It may be reversible or irreversible. Reversible results mild trauma from and irreversible from severe trauma. Medical legal importance is the observation of the patient should be for 24 hours at least at hospital. Results post concussion syndrome, retrograde amnesia, punch drunk boxers and drunkenness state. Cerebral contusion may involve coup or contra-coup injury, shear strain injury, absorption shock waves, penetrating injury and the common skull fractures. Complications are resulting cortical atrophy, brain abscess that results from infection. Medical legal importance of all these are early and proper diagnosis should be done that can save the life of a victim. Thank you all. Assalamu alaikum.